Hi, I'm Donna Sudak. I'm academic head of academic psychiatry here at Phoenixville Hospital. I'm also a professor of psychiatry at Drexel University, and I'm the program director of the general psychiatry training program here at Phoenixville. We are a 4-year general psychiatry training program, and our philosophy has always been about balance. We're really very interested in making certain that residents have a wonderful grounding in neuroscience and in learning about diagnosis, but we want them to be able to apply treatments that are beyond writing a prescription. We really focus a great deal of attention on psychotherapy, and in particular on evidence-supported psychotherapies like cognitive behavioral therapy. We actually provide DBT training, and we make sure that residents get a wide range of exposure to a number of different modalities so that they have really good tools in their toolbox when they leave us. We have a faculty that has a very long tenure as a group, and we really consider ourselves as partners in educating residents, medical students, and other professionals. We see education as really primary to our mission. In fact, the idea for us is that we're working with talented young people to become the psychiatrists of the future. I see the faculty as being supported in a way that's really different than in other places. We are both compensated and promoted for teaching skills. And I think if you're going to be educated somewhere for 4 years, it makes a lot of sense to think about being in a place where the faculty is really interested in your learning as a primary part of what they're doing. I think what distinguishes our program from others is the commitment to psychotherapy training. We're very intentional about looking at their clinical work in terms of recordings that they make with patients to make certain that they are actually able to facilitate the care of someone with CBT or with group therapy or with dynamic therapy along the way, so that it's really a pillar of our training in particular. Our clinical curricula is also incredibly varied. One of the things that I think is a real strength of this program is the number of different clinical sites that we have. We have an urban hospital in terms of Friends Hospital, which is in the northeast part of Philadelphia. It serves a very different demographic in terms of patients. And then our other facilities are in the Phoenixville/Coatesville area. So we have a VA hospital where our residents rotate in Coatesville and see a very different population, obviously, in veterans from all over. Phoenixville draws from a wide range of patients in Chester County. Residents do emergency work here as well as consultation liaison work, so that we have a vast variety of populations and clinical sites where residents get education. I think the other thing that really distinguishes us is the sense that we have of a faculty of really bringing people into the profession and staying committed to them after they are finished the residency. We take great pride and pleasure in being able to help residents with their career in a postgraduate sort of way. We have alumni that are very involved with us. We actually solicit our alumni who go into academic positions and provide grand rounds opportunities for them here, and for them to have the chance to be with and speak with our current residents. People ask me all the time, what's the thing I like the most about the program? And I will say that the residents are clearly the thing I like about the program. They have enriched my life and my practice for many years, and I think the faculty share in that conviction. I'm a better psychiatrist because of them. I'm certainly a better teacher because of them. And we all get something out of our time together. It's really a joy to be able to come to work every day and see them and be involved with them.